Indication for lumbar puncture. Just like the state for sinus disease, sinus infection, bacterial viral mycobacterials, solar node hemorrhage, SAH with negative CT, sinus malignancy, Guillain-Barré syndrome, multiple sclerosis, neuroblastiosis, urgent indication for lumbar puncture due to suspected meningitis, and SAH with negative ST scan, CSF pressure measurement and or drainage, idiopathic intracranial hypertension, lower pressure hydrocephalus, intrathecal administration of pharmaceutical, antibiotic, chemotherapy, anesthesia, contrast, CNS infection, SAH. Number 1, 2 urgent indications, CNS malignancy, CNS disease like MS or GBS, lower pressure like hydrocephalus, intrathecal administration like antibiotic, anesthesia, chemotherapy, or contrast. Lower puncture is a diagnostic and sometimes therapeutic procedure performed to collect cerebrospinal fluid for examination is to relieve increased intracranial pressure. Here are the key indications for performing a CAPI. Indications for lumbar puncture, suspected meningitis or encephalitis, presentation with severe neck stiffness or dermatostasis, and arthropathy. Critical for identifying causative organism, bacterial, viral, fungal, tuberculosis, subarachnoid hemorrhage, SAH. And when a CT scan is negative but clinical suspicion remain high, xanthochromia and disease in CSF can confirm diagnosis. Neurological status is diagnostic regional multiple sclerosis, Guillain-Barré syndrome, and other multimyelinating disease identification of oligoclonal bands, elevated protein, or other abnormal findings. Intrathecal pressure monitoring to predict lumbar puncture to relieve symptoms in conditions like idiopathic intracranial hypertension, IIH, complications, tuberculosis, sinus infection, including fungal infection, eosinophilitis, and viral infections such as herpes simplex virus, inflammatory conditions, evaluation of autoimmune conditions like ambasculosis that may affect CNS, neoplastic disease detection, malignant cells, the CSF in cases of CNS lymphoma, leukemia, or metastatic cancer. Cryptococcal meningitis, particularly in immunocompromised patients such as those with HIV/AIDS, introduction of intrathecal therapies, administration of antibiotic chemotherapy, cooling agent or analgesic directly into the CSF configuration before performing a lumbar puncture. Puncture indication of solid contraindications include lumbar infection at the puncture site, increased intracranial pressure, risk of herniation, and severe thrombocytopenia, and others. Coagulopathies and imaging brain imaging vision CT scan should be considered prior to LP in patients with signs of increased intracranial pressure because neurological deficit or immunocompromised tennis throughout space of the primary lesions concerned. Informed consent should be obtained on explaining the benefits, risk, and potential complications of the procedure. High points knowing watching for the signs of increased intracranial pressure and other potential contraindications. Before proceeding with the lumbar puncture and LP closure of diagnosis of CNS infection, particularly bacterial meningitis, where timely diagnosis and treatment can significantly affect outcomes. Consider the patient's clinical presentation and contraindication meticulously to avoid complications like herniation or infections. So let's some indication of lumbar puncture that testing for CNS disease, CNS infection, bacterial, viral, mycobacterial, cell group, arachnoid herniation, hemorrhage, SAH with negative CT, CNS malignancy, Guillain-Barré syndrome, multiple sclerosis, neuroblastiosis, urgent indication for lumbar puncture include suspected meningitis and SAH with negative CT scan, CSF pressure measurement and or drainage, idiopathic intracranial hypertension, lower pressure, hydrocephalus, intrathecal administration of pharmaceuticals, antibiotic chemotherapy, anesthesia, contrast, CNS infection, SAH. Number 1 and 2 urgent indications, CNS malignancy, CNS disease like MS or GBS, lower pressure hydrocephalus, intrathecal administration like antibiotic, anesthesia, chemotherapy, or contrast. Lumbar puncture is a diagnostic and therapeutic procedure performed to collect CSF for examination to relate increased intracranial pressure. So indication for lumbar puncture suspected meningitis or encephalitis, presentation with fever, neck stiffness, altered mental status, and or photophobia. And critical for identifying causative organisms, bacteria, viral, fungal, or tuberculosis, subarachnoid hemorrhage. The stage when a CT scan is a negative, but clinical suspicion remain high. Cytochromia and RDC in CSF can confirm the diagnosis. Neurological disease, intracranial puncture monitoring, suspicion of CNS infection, inflammatory condition evaluate autoimmune conditions and neoplastic disease detection of malignant cell, culturable meningitis, introduction of intrathecal therapies and consideration before performing lumbar puncture. Puncture indication also like contraindication include local infection, puncture style decrease, intracranial pressure risk of hernia issues, similar thrombocytopenia, and other quality imaging. Brain imaging, usually CT scan should be considered prior to LP in patients with signs of increased intracranial pressure, focal neurological deficit, or immunocompromised status throughout space of finalizing consent. And higher is always evaluated for signs of increased intracranial pressure and potentially contraindication for proceeding with lumbar puncture. LP is crucial for diagnosis to all CNS infection, cause of meningitis, where timely diagnosis and treatment can significantly affect outcome. Consider the patient's clinical presentation and contraindication meticulously to avoid complications like herniation or infection.